And joining us live tonight is Dr. Timothy Quinn, a family physician practicing in the hard-hit state of Mississippi. Doctor, thanks for your time tonight. We appreciate it.
Hey, thank you for having me.
It's a sobering headline. Mississippi has the lowest vaccination rate of any state in the country. Why?
I mean, there are a number of reasons. I'm a family physician, been practicing here in Mississippi for the past 18 years. And this is one of our hardest challenges yet, to get our state vaccinated. Right now, we're lagging behind the rest of the nation as far as individuals getting vaccinated. I think we're about at 1/3 right now. But what we have to do is continue to put the information out there as aggressively as possible. We're partnering with a lot of other organizations, and we just have to keep pounding and getting that information out there.
And one of the other sobering headlines that came out of Mississippi this week was those 7 children in the ICU, 2 of whom are on ventilators. It does underscore the point that younger people now are getting sick, getting the virus, going into the hospital more so than we've seen in recent months. How do you deal with that? Because partly it could be because their parents don't want it, so there's not a priority. And 2, kids under 12 aren't eligible yet, but certainly big news tonight that they may be sometime in the coming winter. What do you make of the situation for kids right now? What should parents do?
Well, I mean, it's so ironic. Earlier today, I did a story on a local network, WJTV, right here in Jackson, Mississippi, and I talked about the new CDC guidelines as far as reopening the schools with in-school learning, as far as the American Academy of Pediatrics advising children to go back to school and whatnot. And I had patients today that actually saw the interview in the waiting room, and they asked me, they said, "Dr. Quinn, are you sure that we want our children to go back to school?" Because people are very fearful. I mean, children are now in the ICU, children are very sick, and people are getting sick, and these are younger people getting sick. So more people are becoming alarmed, which can be a good thing, because now people are gonna maybe take it more seriously, and we can get more individuals vaccinated, and we can get closer to the end of this pandemic. But like I said, we just have to keep educating Mississippians and encouraging and just dispelling all the bad information out there, because that's one of the biggest barriers. Is a lot of people have information that's not accurate, and it's keeping them from getting vaccinated.
And on that exact point, if someone comes into your office and says, "I don't want this shot," for whatever reason, personal, political, what have you, you would say what in response?
Well, I mean, I say that every day. We give the shot right there at our clinic on the spot. And the Mississippi State Department of Health is really working hard with us, individual primary care physicians out in the field, even the smaller clinics like my own. And if an individual comes in and they say, "We don't want the shot," we go straight into education mode. And we explain to them how beneficial the shot can be and how it can have some side effects, but the side effects to getting coronavirus, especially now with these new variants, it can take your life. So we just have to educate them and help them understand. But we get a lot of kickback because there's a lot of bad information out there, things that they might get on Facebook or the internet, just information that's just so wrong. But we give them the correct information, and we just encourage them. And in a lot of cases, we will get them to go ahead and get that shot on the spot that day. And that's what we're doing at our clinic. And we're encouraging all the other providers to do the same.
Well, that's certainly encouraging that you are changing some minds. We're doing a piece later in the show tonight about all the misinformation, the bad information that's out there about the virus. It is worth noting, though, that in terms of deaths, hospitalizations, infections, primarily, the vast majority of those are among the unvaccinated. Taking the long-term view, if we don't, and it's still a plausible if we don't make progress getting more Americans to get that shot in the arm, what is the danger of a large swath of this country remaining unvaccinated?
I mean, one of the biggest dangers which we're seeing every day are the new emerging variants. Because what happens is, if an individual gets infected with coronavirus, and because maybe they weren't vaccinated, so now they have a higher probability of getting infected. Now, some people are getting infected when they've had the vaccination, but the research and the science is showing that those individuals that might get infected, they have a much better chance of having a much better course of disease. When you look at the deaths in the United States, 99% of the deaths are people that weren't vaccinated, meaning that they contracted coronavirus and they got very, very sick, and some lost their lives. But for those out there that don't get vaccinated, they have a higher chance of contracting coronavirus, and now they become a breeding ground for possible new variants. And who knows how effective these new variants are going to be as far as causing us harm. So it's so important we get as many people vaccinated as possible, slow this pandemic down to a halt, stop the emergence of new variants, and decrease the danger of more people losing their lives.
The unvaccinated become a breeding ground for new variants. Now it's Delta. In a few months, it could be something else, and it goes on until we get a better handle on this. Doctor, thank you for your time tonight. I know you're doing some heavy lifting there in Mississippi. Keep at it. We appreciate your work and your time.
Hey, thank you for having me.
Absolutely.